All right, good morning. I am here talking with full professor in the anatomy department, Dr. Barth Wright. Dr. Wright has been at KCU for about 15 years now, and he earned his PhD at the University of Illinois in physical anthropology, and followed that up with a postdoc at George Washington University before coming here to KCU. So welcome, Dr. Wright.
Well, thank you for having me, Dr. Kramer. It's a pleasure to talk to you today.
Well, why don't we start out with just kind of a 30-second elevator pitch of
Okay.
what your current research focus is.
Okay. Well, I actually have really two research foci. The first one is focused really on a more comparative anatomical approach. So I'm interested in how foods and ingestive behavior have led to the craniofacial adaptations and evolution of human and non-human primates. And my other approach is more clinically based, and it is focusing right now. The major project I have ongoing is looking at the anterolateral ligament of the knee with colleagues at UMKC and also a physician that works in the Kansas City area. The interest is in how this ligament assists the anterior cruciate ligament and and how it performs and how it deals with stress and strain uh, when during movement and play and also how it helps to increase return to play when it too is repaired when the ACL is repaired. So kind of two different things ongoing. And I've had a lot of fellows work on different things related to biomechanics of ligament systems and those sorts of things.
Okay. So the ligament that you were mentioning, is it the ALL? Was that
Yeah,
right?
anterolateral ligament of the knee.
So is that commonly injured when someone injures their ACL as well?
Well,
I've
that's
heard
yeah,
I've
yeah,
heard obviously about the ACL quite a bit.
yeah. Well, that's the interesting thing about it. It was actually the interesting thing that came up about it is about, oh gosh, I want to say about 10 years ago. It was spoken of as kind of a rediscovered ligament. It was discussed in the late 1800s. And then it began to be looked at more because of the preponderance of ACL injury. And it was then named the anterolateral ligament of the knee. And what physicians have found, and Dr. Matt Daggett, who's one of my colleagues that I work with, has found that often when the ACL is injured, this ligament is also damaged, either torn or just partially torn to some degree. And what they've found is that when they treat it at the same time that they do an ACL repair, the return to play is much quicker, and the preponderance of re-injuring the ACL is greatly reduced. So it seems to play a significant role there. And we actually spent some time trying to demonstrate that this is an actual independent ligament. There was some argument that it's actually just an extension of the iliotibial tract or band, but we showed histologically that it actually is an independent structure that really reduces a lot of the rotative forces in the knee and seems to be closely related to the function of the ACL and actually has better biomechanical advantage at the knee than does the ACL.
Hmm.
So
Well,
yeah,
that's really
so it's
interesting.
yeah, it's an interesting ligament that is being looked at quite a lot now. So yeah, that's what we're doing right now. And my colleague at UMKC, Dr. Ganesh Tyagarajan, he's an engineer. So we've been looking at how the ligament, when the knee is put in different degrees of flexion, how it deals with the strains, with strain placed upon it in torsion. So that's what we're up to right now.
Great. So you kind of touched on this, but you know, do you think the most important aspect of your research? And you can touch upon both of your main,
Mm-hmm.
um, the focus, and then what is the possible applications for what you're doing for physicians?
Mm-hmm. Well, certainly the primate work that I do is more a question of, gets really at the deeper sort of why questions. Why do we have the facial form that we have? What are the functional implications of that form? And does it lead to a uh, what would I say? I guess a, a tendency toward specific pathologies of the masticatory system or the dentary in certain ways. So that's what that gets at primarily. The the ligamentous, I think it's kind of apparent that it has direct clinical implications. So if this ligament is often torn with the ACL yet not paid attention to, you you lose um, you lose the initial function of the knee, and you have a tendency to injure it in ways that you may not otherwise. So, repairing that when you repair the ACL just seems to make sense. It has direct clinical implication.
Yeah.
So that's really where those lie.
Okay. So, when students work in your lab, how do you think that
Mhm.
helps them prepare for a career in medicine?
Well, one of the biggest things I like to do, and we work with the anatomy fellows as well, a great deal, is to have them, I think whether they're working on a primate uh, study that we have ongoing, or whether they're working on another clinical cadaveric study, what I like to have them do is think about constructing hypotheses, building their methods, um, really going through the scientific process. And in doing so, it's very much like going through a differential diagnosis. So the process of science, no matter what context it's in, and whether it seems to have a more direct clinical application or not, more of a basic science component to it, maybe, and less directly clinically related, makes them think in a scientific way, which then I think enhances how they move forward as physicians and how they work when they do differential diagnosis. And also, I mean, I try to impress upon them, and I think for the most part, anyone coming in to do scientific research understands this. I mean, a physician always needs to still be steeped in the literature. They always need to still be learning. They always need to be applying new tools to how they diagnose different diseases. So I think that's the other part of it as well. So I think that process, getting yourself to think like that, is really important as a physician.
Great. So, just in general, as well, the idea of medical students doing research,
Hmm.
whether it's in your lab or really in any lab,
Hmm.
why do you think, or why would you feel that research in general is important during the medical school education process?
Yeah, I mean, I think it goes back to that whole the method of approaching a problem
Hmm.
and really understanding the application of the scientific method. Again, bears great fruit when you're talking about differential diagnosis. I mean, I remember it was a surprise to me. I had never I realized I'd gotten through much of graduate school, and I realized I'd never had what I would call a scientific theory course. And I was going to be going to do research out in the rainforest, and a lot of what I was interested in were the foods that primates eat. And so I took a botany course, and it was the first time I had a professor really start the whole course by going through the scientific method and having us work through hypothesis development. And what I realized is I didn't really understand what it was to develop an appropriate hypothesis. And it really was really quite eye opening. And I just saw how it made me start thinking in a different way, in a more problem oriented way. And I've just found that to be beneficial with the medical students that want to do research with me. um, so I think that that application is just so helpful for physicians, that application of the scientific theory.
Yeah. It's sometimes if you're not immersed in it, you don't really realize
Right,
all
right.
the intricacies of it,
Yeah, yeah.
and
Well, and
maybe
you
not appreciate it as much.
right. Yeah, I think so. I think so. And if you don't, also if you don't stand back, you don't really recognize the process that you're going through. You don't understand
Hmm.
that these steps are really you know, they're it's a system.
Right.
You know, and it can be, if you understand how that system functions, it can really help you come to more helpful conclusions, I guess
Right.
you'd say.
And it's okay if your conclusions aren't the the specific hypothesis, or
Right, right.
if it
Exactly.
changes.
Yeah, exactly.
Uh,
Yeah, I mean, realizing that really what we're trying to do is falsify hypotheses,
yeah.
I think is really really helpful. I mean, that's kind of the foundation. Is this isn't about you your mind is oriented very differently if you're going in to prove something
Hmm.
rather than going in to falsify something. And it changes the orientation of, like I said, how a medical student will even think about differential diagnosis. Um, you know, what is it that we can exclude first to get ourselves to the appropriate diagnosis?
Right.
Um, I think is really critical. So.
So, how many students or fellows, have you worked with on research in the past? And then, what are
Mhm.
some things they've gone on to do?
Well, gosh, I mean, a lot of I've had summer research fellows that have gone on to present at anthropological meetings, and then I've had a number of fellows that have they were doing more primate research in that instance, but then I've had a number of anatomy fellows that have done. I've worked on either their committee or as their advisor to do a range of different things. So we've had fellows go on to uh, and this is one of the wonderful things about the anatomy fellowship is in almost every instance they get into the field or the specialty that they've wanted to go into.
Mm,
So we've had them go into particularly when I've been advising, gone into orthopedics, but I've also assisted with students that have done work on plastics and facial reconstruction. We've had a number where I've been on their committees, but maybe not the lead advisor, gone into OB-GYN, gone into vascular surgery. We've had actually three, which for DOs is actually a fairly high number, go into ophthalmology as well. And just recently, we actually had a fellow go into to ophthalmology again, doing a study, cadaveric study, actually. So whether I'm the lead or whether I've assisted, it's been a really nice to see them move on. They've taken advantage of the research to and used that to help them move into the specialty that they wanted to go into. So
yeah, yeah. It
it's
can be
been
really
really
beneficial for
nice.
sure.
Yeah, I mean it's been amazingly beneficial, and it's nice. We've gotten some cheerleaders that have been fellows in the past that said, really having the opportunity to do this research was really a boon to their success. So it's been really nice. That's the kind of thing you want to hear. You don't that at on a more theoretical level, knowing how to do science is going to help you as a physician, but to hear that then actually doing the research when they go out and they're interviewed for residencies,
Hmm.
the act of going through the process really helps them get into the field they want to get into. So that's been really nice as well.
For sure.
Yeah.
Well, we'll kind of wrap this up with, if you have some advice that you would give medical students, whether it's
Mm.
about research or
Uh-huh.
life in general. What's
Yeah, yeah.
some advice you would give to medical students?
Boy, on the being a physician side, the more, I guess you call it, the more intellectual and almost logistical side of it, I would say make sure you're always learning. Don't think there's an end to this process. Make sure that you're always delving into the literature, that you're interacting with your colleagues, that you're talking about cases you've dealt with, and you're learning about cases they've dealt with, and you're helping. You're always growing. I would say is a big thing. The other side, I mean, on a humanistic side, I think I've just found, I think a key to success for a physician is being kind. you know, just be kind. Be kind, and that helps you be more thoughtful, I think, too, when you are. There's an being empathetic is part of that, and I think that's a huge. It's less directly related, I think, to what we're talking about in terms of research, but just a general good way to move forward as a physician, or for anybody.
For
So
sure, for
yeah,
sure. I think we
yeah,
could all at some point practice a bit more kindness.
yeah, absolutely, absolutely.
Well, thank you so much, Dr. Wright.
Yeah, my
It's
pleasure.
been a pleasure talking with you, and I know
Yeah,
that
great talking to you.
the university and the university community really appreciates everything you do for our students,
Well, it's
both
a
in the lab and in the classroom as well.
well, I appreciate that. It's a great institution to be at, and it's a joy to work with the students, and I'm lucky to have the colleagues at KCU that I have, and you included, and I appreciate talking to you.
All right. Well, thank you so much. You have a
You
good
bet.
rest of your day.
You bet. You too, Brad. Take care.
Bye.